Welcome to the Fascia-Informed Therapist, the essential podcast for occupational therapy professionals looking to deepen their understanding of fascia's pivotal role in therapy and health. I'm your host, Amy Mayer, an experienced occupational therapist, practice owner, and dedicated educator. Here we'll dive into the fascinating world of fascia, exploring its significance in the human body and its critical influence on occupational therapy practice. Each episode will bring you cutting-edge insights, expert interviews, and practical strategies to help you confidently integrate the science of fascia into your therapeutic approach. Whether you're a seasoned practitioner or just starting out, our goal is to equip you with high-quality, evidence-based, and fascia-informed continuing education opportunities that will enhance your skills and benefit your clients. So join us as we unravel the complexities of fascia and transform the way you practice occupational therapy. All health and wellness practitioners are welcome. Let's learn, grow, and evolve together. Hi, this is Amy, and this is another edition of the Fascia-Informed Therapist. And in this edition, I'd like to talk about hormones and being postmenopausal. And this is not about me, but I'm going to share a little bit about my own journey and how that intersects with fascia. And I want to give a big shout out to the MDs and other women who are online and they're writing books and they're online and they're talking about menopause and hormone health and how important that is. How important that is not just to pay attention to it for our comfort, but for our overall health. And in my own personal journey, it was probably about 5 years ago, I went to my physician, who was a female physician, young. I'm going to guess her age is in her 30s. And I was explaining to her how bad my hot flashes were, day and night, and it was really frustrating. I was also having upticks in anxiety, and I was also having some other feminine issues that I was concerned about. And she was, I would say, pretty negative about me. She really didn't have anything to offer me and was kind of negative about going on any kind of hormones. And at that, I've always been a person who I'm going to try to do things as naturally as I can before I take any medication. And I felt like I was eating right, I was exercising, I was doing all the things, not perfectly. I am in no way, because as you've heard me say before, I don't like to exercise. But I'll do what I need to do in order to feel better. And I felt like I was doing all that. And my physician really recognizes that that's me, that's who I am. And I've likely tried everything that I can in terms of feeling better before I come to her and want to have a conversation about hormones or whatever I can do to help myself with these problems. And she basically said, it's dangerous, you can go on them, but you have to get off of them in 5 years. And I'm like, okay, what happens in 5 years then? She's like, all your symptoms will probably come back. And I'm like, that's really all the better we can do for women. I was upset. I mean, me getting upset is not, it doesn't look much different from just me, but it all happens on the inside rather than the outside. But I was disappointed in the research that we had available and her knowledge about it, what I could find for myself. And I think we ended up doing some topical estrogen, and it really didn't do much of anything for me. So I just continued to have all my symptoms and dealt with it. And to go back even farther, I was experiencing perimenopause symptoms in my 30s. And I remember having hot flashes, and I thought, oh, I'm just, because I'm a redhead and I'm, have very pale skin. I mean, people would look at me and it was like, what's going on with you? Because it would start in my gut and my chest, and it would just work its way up into my neck and then my face, and I would turn this bright color of red, and then I would start to sweat. I mean, it's ladies out there. I mean, I've talked to ladies who I've never had a hot flash and they don't really have any problems even in menopause, but a lot do, or they have other symptoms. And I am absolutely thrilled and want to commend the women who are out there, the MDs and other professionals who are getting information out there, because the tune has changed dramatically in terms of women's health and the research that's out there and the interpretation of the existing research and new research coming. And it's just making a massive shift for women, of even women who are still cycling, and then women who are in perimenopause, and of course, women who are postmenopause, like myself. I believe it's Jen Gunter wrote the Menopause Manifesto, and Mary Claire Haber wrote the New Menopause. And when I read her book and then started following her on social media, that literally changed my life. Because I was about to go out of town on a little writing retreat last December, and I messaged my physician and I said, I want hormones. I want you to write that script now. I will come back after my time away and we can do some blood draws and look at my testosterone, but I want an estrogen patch and I want a progesterone pill pronto. And she's like, okay. And she wrote it for me. I picked it up. I took it with me. I went down to Arizona for a little, I don't remember how long that one was, 2-week writing retreat, and started my patch and started my progesterone. And what moved me back to, after I read the book and then contacted my physician, I was having more things going on that were unexplainable. And I was having this weird pain in my feet, and I wasn't doing anything differently. And then the other symptom that I was having that I was really frustrated with, and no matter what I did, it was just getting worse, was my cholesterol. And my physician over the past 5 years is practically begging me to go on a statin. And I'm not here to give anybody medical advice that's outside of my scope of practice. But I was like, I really didn't want to go on a statin. I wanted to do it naturally. I was going to figure it out. And she kept telling me that's not possible. That's not possible. You have a family history of this, because clearly you're doing everything right, but it continues to go up. And I'm like, I do not have a history in my family. And I know my parents' medical history because they have a big, long one, both of them. But she insisted it was something that was completely out of my control. And now there's studies connecting, as your estrogen decreases, your cholesterol can increase. And that estrogen has a lot of protective functions for your heart and your cardiovascular system. So I've been on now the HRT, hormone replacement therapy, since last December. So it's, as of the recording of this, it's the end of May. And I have slowly increased the level of my patch because I requested to start at the very lowest level possible to see what would happen. And to go back to December, I was on the patch for a week and my hot flashes were decreasing significantly. And when I was on the patch for about a month, the pain in my foot went away. And I was sleeping better, and I was experiencing all these observable changes in my body. So I'm thinking, whoa, I wonder what's happening with my cholesterol and my bone health and all these other things that estrogen is helping with. So after being on 3 months on the lowest level patch, I requested to go up, and each time I went up, I experienced some weird symptoms in my body that probably was getting used to the estrogen. The first time I started, I was having some weird discharge, and the second level of estrogen patch, I had significant breast tenderness, but that both went away within about a week and a half, and then I started to feel even a little bit better. So I'm feeling like the third level up, which I don't remember exactly what that is, I don't have it in front of me, is probably where I'll hang out for a little while. We'll see. I did go back to my physician in probably toward the end of the second level of patch, and had my blood drawn to see what my levels were, and they were still like kind of ridiculously low, but I was feeling better. And I should also include, had my testosterone checked, and my testosterone is absolutely fine at levels in a healthy woman of pretty much any age. So didn't need to add any testosterone into the mix. But I believe when I went back and talked to my physician a couple times after I started the patch, she was now doing her own exploring, and she was totally on board, and she was like, okay, we got to get your estrogen up to 46 because that's when you start to experience the protections of your bone health. And I'm like, awesome, let's keep working at that. So I don't know where I am right now, but feeling pretty good. It doesn't mean I don't have pain in my body. I'm dealing with a little bit of plantar fasciitis right now from something kind of dumb I did recently. But this chronic neck and shoulder pain I've had since high school is actually easing up a little bit. It's easing up. It's not nagging at me as much as it has my entire life, despite whatever therapies I've tried for it, including myofascial work. And it does help it, but it tends to come back. And that's a whole nother topic of discussion. But let's talk about hormones and the intersection with fascia. And I think this is a really important layer that not a lot of people are talking about yet. The social media people like Mary Claire Haver, and it'll get there. It'll get there. However, the Fascial Research Society just did a series of webinars on women's health, and I was able to listen to the last one recently where they talked about hormone health, and Katerina Fede, FEDE, talked about a lot of her research, and it was absolutely wonderful, and things are really going in interesting directions. And those of us who are aware of fascia and integrate fascia into our practices can really have a whole nother potential answer for women who are in perimenopause and postmenopause in terms of something else to explore. Again, I think all the problems we have in our bodies it comes in layers. It's never one thing. But when you have something else that you can throw in the mix and explore and try, that can be a really important option for people to just be aware of. And I would say most of the people that I see on my caseload are women who are at least in perimenopause and more likely in postmenopause. So anyway, so I made a list of just all the different symptoms that we can look for. And as people are paying attention to fascia, I mean, I know not everybody that listens is an occupational therapy practitioner, but when we're working with people, and pain is a confounding variable on everything that we do, all the diagnoses that we see, the people that we work with, almost everybody has pain connected with a diagnosis. So can we just explore and ask, and maybe it should be a question on an evaluation. Are you, when they're talking about medications, are you on hormone replacement therapy? Are you aware of hormone replacement therapy? And I'm, again, not advocating that everybody goes on it, and everybody's method of how they take it and what they take will be a little bit different depending on their medical history. But there's options for everybody, especially if you're having symptoms. Now, one of the most important things I think to think about here is that most of the time when women are in menopause, we think about hot flashes and poor sleep, maybe brain fog, but there's a whole lot of other things that are now being connected with decreases in estrogen in perimenopause and postmenopause. And a lot of that is musculoskeletal, I'll say fascial musculoskeletal issues, joint pain and stiffness, increases in osteoarthritis, more myofascial pain. Myofascial pain syndrome is definitely an uptick in diagnosis, decreased muscle mass and strength. Then there's also cardiovascular health and increased risk of cardiovascular disease. There's less vascular protection because estrogen helps to maintain healthy blood vessels. Elevated cholesterol and blood pressure, if you're seeing upticks in those things, but you're not doing anything different than you've ever done, then that can be an answer. Cognitive and neurological function, memory and concentration, increased risks of dementia, mood swings, anxiety, and depression. And Mary Claire Haver did a post not that long ago on, and I want to go back and find that article. She put up an article and she was saying that when women experience changes in estrogen and perimenopause, they can have I don't know if flare up is the right word, they can experience new mental health issues, or their existing mental health issues can get worse. And they might need medication changes if the hormones are changing. Or I cannot say, it's because I didn't read the article, so I do not know if they're suggesting that if they get on hormone replacement therapy, that's not going to be as significant. That's a whole nother topic to explore. But those of us that work in the areas of mental health, I mean, that's important information that should be explored in women who are having new problems or worsening of existing mental health issues. Immune and inflammatory responses, increases in chronic low-grade inflammation are just, feeling worse and no answer for it. Exacerbation of autoimmune conditions, reduced immune resilience, and then, of course, the pelvic health issue, increase in vaginal dryness and atrophy, incontinence and urgency, increase in UTIs, and then we have the category of sleep and energy, fatigue, restless legs, sleep disturbances, insomnia, metabolic and endocrine changes, weight gain. That's something else that I definitely have noticed in myself is it is hard to take weight off. It's so easy to gain it and hard to take it off. And throughout my whole life, I've kind of swung back and forth and get a little lazy in my eating, and then I clean it up again. But man, and more around. I've always had a little tiny waist my whole life, and plentiful hips. But now the weight is gaining around the abdomen, and that's the worst kind of weight to have because it puts the pressure on your organs. And then insulin resistance. That was another thing that had an uptick in my blood work, and I have been able to get that under control with diet. But like, wow, why? I don't have any diabetes in my family either. And then, of course, bone health and skin tissue integrity, thinning skin. So anyway, what's important for me in my practice is the pain, because that's what I mostly deal with my clients is their pain issues. And so many of I have one client who's kind of jokes when we kind of joke when she shows up, and she comes for regular appointments, and it's a good thing she does because we joke about, okay, what's new today? Because she always brings like, I don't know why this hurts, but this is hurting, and we can address it when she's there. And anyway, so women are twice as likely to experience chronic pain than men. And when you get into post-menopause, I think it's like 85% of women experience pain. And it's around 20 or 30% of those women who experience severe pain that affects daily life. And that's something that needs attention and should be focused on. So here's the intersection with fascia. Fascia has hormone receptors, and Caterina Fede was talking about this in her webinar that she did from the Fascia Research Society. And if you're not a member of that, I highly encourage it. If you are into fascia, do fascia work. It's a great place to get a lot of information. I'm trying to take some of that information that they're giving and funnel that into what's important for occupational therapy practitioners and other people who do fascia work. So it has hormone receptors. And the interesting thing is, as estrogen goes down and there's less of it, the fibrosis in the fascia goes up because it starts to produce more of the collagen that makes us stiffer. And we know when estrogen goes up, like when we're pregnant, then it produces more, the fascia, the fibroblasts produce more of the collagen that is actually more flexible, and it produces relaxin, so the body can expand with the baby and then expand in a way that the baby can come out. So, but when the estrogen goes down, everything gets stiffer. And there's changes in the HA, the hyaluronin, and things can get stickier and more stuck, and there's less glide in the tissues. And that decrease in the HA actually happens in men too. But when our estrogen goes down and the fascia is stiffer, and then we have more gluey or sticky or less HA, then that's trouble. That's all the nerve endings that are in the fascia are going to get more pressure than they're used to, and hence the chronic pain. Now, I'm sure there's lots of other things going on in the body, and again, it's never one thing, but again, the fascia provides us another layer of how to look at and think about the body and provide suggestions and potential relief for the people that we work with. So what can we do as practitioners to help our clients? And the first thing I would say is educate yourself a little bit about hormone health and what some of the options are for estrogen. There's the Menopause Society has some wonderful resources that you can look at. They offer a certification, but I looked into, oh gosh, I would really love to get that. It's maybe more than I can, more learning than I can dedicate myself to right now. And I think it's really more geared towards the medical practitioners like MDs, but other healthcare practitioners can do that. And I think it's doable for somebody like me or a lot of you who are listening. It's just you would need to dedicate some time to study and really go deep into understanding this. But there's a lot of other things you can do, like reading the 2 books that I had suggested and understanding the basics and not giving medical advice, but there's just a whole new way of thinking about hormones now for women that's been kind of ignored. I mean, this is another that we say fascia has been ignored for a long time. Menopause has been ignored for a long time too, and now these 2 things are intersecting and we can possibly give answers. So educating yourself a little bit about that. And I will put in, I would encourage you to, I'm not very, my daughter says I change my sentences mid-sentence quite a lot, and I'm hearing myself do that right now. I'm not great with putting up show notes because I'm kind of a one-woman show when it comes to this podcast. But I am pretty darn good at getting my newsletters out on a fairly regular basis. And I can put all the references in an upcoming newsletter for this particular podcast. So educating yourself and educating your clients about potential options, or at minimum that they should speak with their medical professional. And Mary Claire Haber does a great job in her book saying these are the questions to ask, because a lot of medical professionals, and I still run into clients who are facing this, is a lot of medical professionals still believe all the old information about hormones for women. And the same way I still run into medical professionals who think fascia is something that you cannot impact. Old beliefs, old information. And then teaching people how to move with their fascia in mind, and that moving more regularly is better than small bouts of movement. I talk about some studies in the movement and the posture class that a study that clearly stated that moving 5 minutes every hour nets you more benefits than walking 30 minutes once a day. So moving more regularly and also teaching people to stretch gently, to incorporate stretching. So many of my women who are clients, and they think they've got to get back into exercise, and that's a great idea. They absolutely should. I support that. But they ignore stretching. At least do mobility. And when I say mobility, I'm talking about moving your body and your joints through their full potential range of motion, nudging into those end ranges. And that's going to help you create that glide and maintain that mobility in all your joints. And when you try to do that, you get more full body movement. So encouraging those things. Teaching people how to diaphragmatically breathe. Simply that can make a big difference in the glide in the main area of the body, the torso, I should say. Teaching people about hydration, and that it's not just drinking water. You've got to drink the water, and then you've got to move in order to pull that water into the fascial system. So those are some of the things that you can teach your clients about, and that if you are moving into menopause and you are experiencing more discomfort in your body, you've got to move and exercise, or I hate to even use that word because so many people don't like exercise, but you've got to move with your fascia in mind and integrate more movement into your daily life. And that can make a huge, huge, huge difference. So, okay, I think we'll wrap it up there. If you're not on the newsletter, please sign up for the newsletter. Go to fascia-informed.com, and at fascia-informed.com, you also see a link to all our online courses. I'm going to be releasing a new course here for the public on myofascial pain syndrome. It's a great one for therapists too, to get more familiar with that diagnosis and all the options for treatment and what we can do as practitioners to help our clients, because that diagnosis is coming on referrals to my office, and it's probably coming to yours too. So I think we're good. So thank you again for listening. And again, I'll send out those references in a newsletter. Take care, everybody. Thank you for tuning in to the Fascia-Informed Therapist. It's been a pleasure sharing insights and strategies to help you integrate fascia science into your practice. I'm Amy Mayer, and I hope today's episode has inspired you to explore further and take your therapeutic skills to the next level. Remember, we're committed to creating and providing top-notch, evidence-based, fascia-informed continuing education that empowers you as an occupational therapy practitioner. Stay connected with us for more enriching content, and don't forget to check out our online courses to deepen your expertise. Until next time, keep expanding your knowledge, refining your skills, and confidently applying the science of fascia to your practice. Here's to advancing together in health and wellness.